The interagency task force recommends the optional use of face masks outdoors. While this have yet to be implemented, the palace says the recommendation received positive feedback from the president.
The president has given his verbal approval when the secretary of the ILG called him.
Mga panuntunan para gawing voluntaryo na lang ang pagsusuot ng face mask.
We should consider what is our current rate of positivity, what is our current rate of people having the infection, the number of those vulnerable developing severe disease.
While back this recommendation from the IATF, how confident are you that Filipinos can now manage and police their own COVID risks?
Well, a couple of weeks ago, we came out with our Father Nick and I came out with a press release, saying that I think we should move forward. Filipinos are learning to live really with COVID. We can see that very clearly. Booster uptake, unfortunately, is not where we want it to be. I think it's something that we still have to continue to push, but then again, we have to respect the freedom of our people, to freedom of choice.
Singapore and Malaysia have done it. That is, make the wearing of masks optional outdoors and indoors. But if the health department would have its way, face masks should stay on. Businessmen and tourism stakeholders have a different take. We discuss points of view in this episode of The Chiefs. Welcome to this Thursday edition of The Chiefs. Now, most businessmen welcome the Pandemic Task Force's recommendations to make masks optional outdoors. Let's see if our guest is one of them. Welcome back to Chiefs, Mr. George Barcelon, who is the president of the Philippine Chamber of Commerce and Industry, or PCCI. Sir, magandang gabi and welcome back to the Chiefs.
Good evening.
Yes, sir.
I hope I'm coming in clear.
Yes, sir. You're coming clear. We're just waiting for our other co-anchors. But in the meantime, let's start na, sir. With a few questions. For example, ang sabi po ng DOH, si Secretary Vergeire kanina, mukhang may hesitation yung health officials doon sa recommendation to make masking voluntary outdoors. Pero mukhang nanaig yung economic sector o yung economic advisors ng Pangulo dahil para daw mabigyan ng tulak yung negosyo, yung business sector. We're wondering, sir, from your end, from your point of view, just exactly how big an impact would voluntary masking be for the economy?
You know, I think the impact is very big by the mere fact that the psychological effect that we have been able to mitigate COVID-19 in a very positive manner. This would lead to more confidence in the private sector. And of course, that refers to the business sector to go on with their business activity. I'm sure President BBM, from his trip to Indonesia and to Singapore, has personally seen that these two countries have been very relaxed in the requirement as far as wearing of masks. And I do agree that it's a voluntary basis for those who have comorbidity, that they are aware that they should protect themselves. I would let us be cognizant of the fact that the general populace are responsible people. If they feel that a place is too crowded and they need that extra protection, they would put on their mask. But open door outside, I've seen in many areas that there's the mask is not necessary.
I think naman, sir, a lot of people would agree with that. Na outdoors o open air, hindi naman talaga ganun kalaki ang pangailangan for masking, especially pag walang katao-tao naman sa paligid. Pero sir, I think one of the main reasons that was brought up was yung tourism. A lot of people, a lot of foreigners now do not want to visit the Philippines, especially because they would be required to wear masks both indoors and outdoors.
Yes, that is very true. And that is something that when I had a chance to talk to Secretary of Tourism, Christine Frasco, I did mention that. I said, people traveling to Thailand, Thailand has already downgraded the COVID-19 as just the regular flu. And you can see the tourists going back in great numbers to Thailand. And it would be good if we, not that we're not responsible, but we know that the COVID-19 infection has tapered, and as the numbers per se is quite negligible. And then if we talk about the mortality rate, it's really way below. And that should not restrict this opening up of our economy. And tourism is one of the sectors we highly promote.
Also, sir, pero on the other hand, for example, si Dr. Ronjin Solante, I'm sure you've read about him. Si Doc Ronjin is often a guest as well here. Ang push niya is okay, if we have to do that, let's do that. But let's do it on number one, staggered basis. Number two, let's be selective kung ano mga rehiyon o ano mga lugar o ano mga syudad ang pwede lamang gawing voluntary yung masking. Where, for example, COVID infections are not so high, or perhaps where vaccinations are much better than in other provinces or in other regions. Kumbaga, may paghihimay kung saan lamang dapat itong pagluluwag.
Alam mo tungkol dyan sa anong klaseng restriction, no? Noon pa, we always approach it by granularity. Okay? Kaya ang local government, malaking role nila. Kung nakita nila na may mga lugar wherein there's a cluster of infection, dapat pag-implement na granularity yung mga restriction. But alam mo yung dinaanan natin ng itong election, no? I've seen the various campaign that went on March and April. Katakot-takot ng tao. They're all clumped together, hardly without wearing masks. And
they're shouting, they're cheering.
We haven't seen any drastic increase in infection. I would not debate the doctors that to be careful. We still need to be careful that the COVID-19 is still around. But as what other countries have experienced, pinag-downgrade nila because it's treatable. The mortality rate has been quite acceptable. There are other deaths that are more happening. I remember one time with the dengue infection. So we are really for opening up, but we have to be again cautious about what area that may have more infection and to deal with it.
Sir, when you say we just have to be more cautious about the areas where there are more infections, by that are you in effect echoing Dr. Ronjin's statement that we should be more selective in what areas to loosen up, or are you just saying na let's have a quicker response time pag may infections sa isang area, then we clamp down again?
Alam mo yung mga lugar na sa ngayon we have not even with the contact tracing really showed that there are areas that has been that are the infection cluster area. It's spread across and an example that I would share that our general populace responsible sila kasi alam nila na kung nahawa sila baka mahawa yung anak nila, yung magulang nila, at saka yung livelihood nila. And they're very careful. And I think the local government is also concerned na kung nakakita nila na may mga tao na naka-COVID, na dumami, again, granularity, they will immediately treat them. And that has been, I think, the protocol that we've been following. I remember during the time when our President Secretary of Local Government, Secretary Benher, was the MMDA. And I used to share with him our thoughts that for us to really normalize the protocol has to be in a way that builds confidence sa mga taong bayan natin na alam nila na the government now can treat or have available healthcare centers. At saka yung hospital, hindi naman na hindi naman inundated, no, with COVID-19 patients. So all the safeguards, I think, is there. And I fully endorse yung sinabi ng IATF that voluntary, indoor or outdoor.
Teka, sir. I'll also want to go into that the possibility of indoor voluntary, but I'll park that muna for a moment. If I may, sir, can I ask you if it's possible to quantify or well, put a number dun sa possible effect sa ating economy o sa negosyo nitong pag-shift sa voluntary masking? In whatever metric form that you would like. I'm just looking for a way to quantify the impact of this on the business sector and the economy.
At this point in time, as we move towards the bear month,
Yes.
based on our past experience, the month of October, definitely, the retail sale will increase by about 15 to 20%. And furthermore, November, it will be about 30 to 40%. And it peaks sometime in December because the 13-month bonus of
Yes,
both
sir.
private sector and government will be released. So I would think that, even if we have this voluntary policy of whether to put on a mask or not, the numbers will prove itself that the consumer wants to spend during the bear month, and again, just to have the necessary prophylaxis or whatever medical preparations would be good. I wouldn't fault the medical professionals.
Yes, sir.
Talking about preparations, prevention is always helpful, no?
Yes, sir. And that's the
in
role,
case
yeah.
something might arise.
Yes, sir. Yes, sir. Yeah, yes, sir. Well, I understand what you mean when you say na 15 to 20% increase in October and 30 to 40% increase in November. That's by tradition. I mean, that's by historical
That's right.
data.
That's right.
Yes, sir. But I'm wondering lang again. I'm just taking a chance here. Would you be able to quantify or put a metric to yun nga kung mag-voluntary tayo na masking outdoors at least, how do you imagine the impact
let
be?
me share with you yung experience ko, no?
Yes, sir.
Kababalik ko lang sa yung mga business conference namin. Last 2 weeks, first I was in Ormoc.
Yeah,
Okay.
right there.
And then after that, I flew to Surigao to meet our local chambers there, no? Visayas and Mindanao. I can feel that the general populace, okay, yung confidence nila sa ekonomiya natin sa itong issue na COVID-19. Noon, during the conference, of course, we follow protocol na nakamask kami. But as we went on speaking or eating, wala akong choice eh. Kailan tanggalin mo yung mask.
Yeah,
okay? And I feel that, again, that's what I call voluntary. If you want to participate in an event like that, wala kang choice. You have to take off your mask, to eat or to talk. But if, let's say, you can see that the place is quite crowded, at saka in the public place na hindi mo kilala yung mga nasa tabi mo, just to have a preventive protection, you wear mask. Kaya I think that's where the voluntary comes in, no? As far as number, for me, personally,
Yes,
what I saw when I went there, I can safely say that you're talking about a good 5 to 10% more activities that will be brought about when people have the confidence to go out and feel that they don't have to really wear a mask, as if things are normal. Okay? Normal, how we define normal nowadays may be different from the normal before.
From 2 years ago.
Nakahanda naman tayo lahat eh. Even if I go out, I can see everybody has a mask in their pockets na kung kailangan, they wear it.
Sir, let me welcome first of all si Ana Marie Pamintuan to Philippine Star. Ami, thank you for coming in. But Ami, before I let you, before I pass it on to you, can I ask one more question kasi baka malimutan ko eh.
Yes, go
sir.
ahead.
Sir, anyway sir, kasi Malaysia for example, in April pa of this year, already made voluntary yung outdoor masking. And then this week, their health minister announced that even indoors, voluntary na rin yung Malaysia when it comes to masking. Now, I bring up what you said a while ago, if I heard you correctly kanina, parang, and tell me if I got this right, parang I heard from you kanina that you're looking at voluntary masking for both indoor and outdoor activities. Did I get you right?
Yes, I think that should be the definition of wearing voluntarily the mask without any conditionalities. The conditionalities depende sa tao na yon. Halimbawa, earlier I said, kung alam nila may sakit sila, may comorbidity, dapat nakamask sila. But as far as what I've seen in Thailand and Singapore, they do not impose anything to that effect. But we still see that some people do wear masks for whatever reason that is peculiar to them. And there's nothing wrong with that. Wearing masks, there's nothing wrong with that. Not wearing masks, again, there's nothing wrong with that. Again, it's a voluntary decision. And I think people now are responsible enough when they know that they have to, on certain circumstances, they have to have that extra protection. Voluntarily, they should wear the mask.
Well, Ana Marie Pamintuan of the Philippine Star. Ami.
Good evening, Mr. Barcelon. Sorry.
Hi, good evening.
Niintay po namin yung resulta ng meeting in Malacanang between the President and IATF. May kumuha nagkakahirapan yung mukhang matindi yung debate doon eh. Hanggang ngayon wala pang announcement.
Alam mo, kaya ngayon lang nakakasama ko si Joey Concepcion, di ba? Pinag-usapan namin itong mask.
Yes.
Sabi ko, alam mo, ang presidente natin, pagbalik niya, yung nakita niya first hand, yung sa Singapore, sa Indonesia, hindi naman wala na yung imposition na you have to wear mask. Okay, and I would think that from his point of view, he can see that if other countries, ASEAN countries, can do that, tayo naman nakahanda yung mga, as far as I said, as far as I mentioned earlier, hospital.
Yeah, I think
Healthcare center.
Yes.
Why shouldn't we do that also?
But on the other hand,
May problema sa hospital.
but on the other hand, you also concede na kailangan pa rin nating to move with caution, ano? In your case, for the business community, what measures do you want to see in place in case we start easing the mask mandate?
You know, actually, this is a personal comment. No? Those people taking public transportation, because hindi mo kilala yung mga nakaupo sa tabi mo, yung mga nakatayo sa... Those, if I were the one, ako, voluntarily, I will wear mask. But let's say if I go to the office, under that kind of environment, I will be very confident not to wear mask. Okay? Or let's say a place wherein I go, lately I've been to the malls, no? And I noticed na talagang people are there, no? And I can, yung observation ko lang, mga 30% are still wearing masks.
What about
medyo disiplina mga tao natin eh.
What about in schools? How early do you think we can start easing mask mandates?
In schools, no, I don't have the data, but I haven't seen too much, no, na yung mga kabataan natin na infected seriously. yung T-cells, yung mga natural immunity ng mga bata, iba naman eh. They can deal with it better than people that are older. It would be good, I think, that I believe when they go to the malls, when they go to the public places, somehow they're exposed to the virus. No, I'm not a doctor, but I'm just using this anecdotally. Now they've been out, they've been exposed. And their immune system, I think, has been able to cope with it. And then, unless we really try to move towards the direction of normalcy, yung aspect na lost years of education, malaking bagay sa atin, malaking bagay sa industriya, Yung manpower natin, yung mga kabataan natin, they lost 2 years of education, and that really affects the quality of people we're getting for the industry.
Sir, have you by any chance transmitted or indicated to Malacanang or to government your idea na indoors and outdoors na dapat yung voluntary masking?
Well, we have. I mentioned after our business conference in both Visayas and Mindanao, they put out a resolution that the protocol for quarantine at this point in time should be relaxed. Now, they have that right to say it because they're from that area.
Yeah.
It's not something that we impose na our views because we're national NCR kami. Sila taga Ormoc, taga Tandag. They see for themselves na they're quite confident na mag-normalize yung natin, yung social life natin, yung education, yung negosyo. And I don't want to. I think that having that outlook, that is a positive thing. Pero alam din nila na in case there is outbreak, they have to be prepared. Yung mga LGUs, all of our discussion on what are important looking forward, healthcare is always top of list. Yung dalawa na yan, healthcare at saka education.
Okay. Mr. George Barcelon, sir, thank you very much for joining us tonight. We hope to see you again and we hope to talk to you again very, very soon. Ingat po parate.
Sige. Maraming salamat po. Thank you. Bye-bye.
We are starting up another conversation right after this break, so please stay with us.
Said it would have wanted to retain the mandatory wearing of face masks as policy after the IATF recommended its optional use outdoors.
Ito pong pinayagan at inirekomenda ng IATF is only outdoors. At ang kompromiso po na naibigay ng Department of Health sa IATF ay gagawin lamang ito sa low-risk areas at saka sa low-risk individuals.
Vergeire said there were data presented that supported IATF's proposal.
We have a meeting with the President this afternoon together with DILG para ipaliwanag sa kanya ng gusto. Ito pong nirerekomenda ng IATF.
You're still watching The Chiefs here in One News. We are continuing our discussion on optional masking outdoors. And joining us via Zoom now is Health Officer in Charge, well, we prefer to call her Secretary, Secretary Rosario Vergeire of the Department of Health. Ma'am, maraming salamat for joining us tonight and welcome back to The Chiefs.
Good evening.
Magandang gabi po. Good evening po sa inyong lahat.
Yes, ma'am. Ma'am, as of yesterday, we understand na yung optional masking proposal was still a proposal that had a verbal green light from the President. But we also understand that today may meeting ang IATF and we're wondering kung meron ng updates as to whether or not there's a final formal green light to that proposal and whether or not that proposal has been fine-tuned to any degree.
Yes, sir. No? So kanina po nakipag-meeting tayo with the President and until it is articulated through a form of a policy coming from the Office of the President, that's the time that it becomes official.
Opo, nabitin ako doon.
Oo nga.
Pero
Pwede namin sabihin na pwede namin sabihin President Marcos has already approved. Is that accurate?
Yes, that is accurate. But as I've said, we only start formal or official implementation and this becomes official once it is in a legal instrument of it.
Yes, ma'am.
So wala pang specific date for implementation. Kasi yun din yung medyo malabo, akala ng mga tao Immediately, implemented na siya.
Yes, yun nga po yung gusto natin maipaliwanag, no? Kasi kanina po marami nang tumatawag dahil tinatanong na, no? So hindi pa ho natin uumpisahan hanggang hindi lumalabas yung policy na ipapalabas po ng Office of the President. And kanina naman po na-instruct ni President na yun pong EO na kailangan ay ipafacilitate nila ASAP.
So ano kaya yung target date of implementation? Within the month or October pa kaya?
No, it's going to happen soon. So it's within a couple of days maybe. Pag lumabas na po yung EO, it's going to happen.
A couple of days lang. Okay. So ano yung wala bang nag-express ng the strong masking is always the last to go dapat?
Well, yes, that is also the position of the Department of Health, actually. And this has been mentioned over and over again by the department. Kaya lang po, this is a collegial body, no? So the other sectors also presented their evidences. And towards the end, for us to have compromises and agreements, ang atin pong compromise dyan ay gagawin lang yan sa ating mga low-risk settings at saka sa low-risk individuals so that the risk would be minimized, kung baga. So yan po yung napag-usapan at nagkaroon naman ng resolve dyan. So we are preserving na kailangan yun pong mga nakakatanda, senior citizens, and those with comorbidities are still highly encouraged. Transport sector is non-negotiable. Kailangan pa rin pong mag-mask. Kahit nakapila ka lang, ang atin pong mga magulang highly encouraged din na pag-mask pa rin yung mga bata papunta sa eskwelahan.
Low risk areas, are you referring to circumstances or are you referring to geographic areas? For example, certain provinces and regions where, for example, vaccination is not so high or where COVID infections are a bit higher than usual? Or are you talking about circumstances? For example, ganitong klaseng kalagayan kailangan magmaskara o ganitong klaseng kalagayan hindi kailangan magmaskara?
Yes, we're talking about circumstances, sir. So kapag halimbawa, ang isang pwesto ay crowded, ang isang pwesto ay pangit ang daluyan ng hangin outdoors, so we are not encouraging people to remove their mask.
Ay asset po kasi si Ron Jean Solante, si Doc Ron Jean was making a push for selective voluntary masking depending on your geographic location and yung COVID infections So
I don't think that's going to solve any of the issue right now. Ang kailangan natin lahat balikan, what would be the risk of a person? Let's go back to the individual's risk assessment. Halimbawa po tayo, kung tayo lalabas, alam po natin sa sarili natin because we have layers of infection, of protection. Halimbawa, ikaw ay nagmamask, ikaw ay lagi nag-uugas ng kamay, ikaw ay nagpabakuna, alam mo na crowded, alam mo na maayos ang daloy ng hangin. Pag tinanggal mo dun yung mask, kailangan meron ka pa ring safeguard. So alam mo sa sarili mo kapag crowded yan, wala kang mask, baka ma-infecta. lalong-lalo na kung hindi ka bakunado. So this becomes a push for people also. In order for you to be confident, you need to have yourselves vaccinated so that you can always remove your mask pagka nandun kayo sa labas. Pero of course, the other circumstances should not happen also, like crowding and poor ventilation.
Baka magkaroon din ma'am ng confusion, no? Halimbawa especially with the approach of Christmas, dumadami yung shoppers. Paano yung mga outdoor commercial areas? Halimbawa sa Divisoria, sa Dapitan Arcade, nagsisiksikan na hindi na makagalaw yung mga tao ron. Are you requiring masking or optional din?
Oh, well, if we say it's optional, it's voluntary. Kaya nga sinasabi po namin, ma'am, this time around, it boils down to a person's perception kung ano yung risk level ng pupuntahan nila. Definitely, kapag yung mga ganyan po, yung mga tiyangge na maramihan tao, that's crowded. We should encourage, no? Ang local government should help us encourage people to wear their mask in this kind of situations.
Pero hindi na siya mandate. It's no longer required.
Yes, it's optional. That's why we are now trying to emphasize and repeat and reiterate to people, now we need to determine our risk level. So alam natin kapag pumunta tayo dyan, we wear mask.
Ma'am, how much flexibility would be given to LGUs, for example, or even to building administrators or administrators of public areas in terms of determining whether or not it's a crowded situation, even if it's outdoors, or whether or not masking should be required. Alam mo yun, kasi ngayon, di ba, some LGUs are asserting themselves na they have ordinance powers, they have powers of legislation on their own, and they could use that. I'm wondering just how much flexibility would be given to these managers, whether they're executive managers or LGU managers, in determining yung masking. Kung kailangan i-enforce ito, kailangan ba manghuli ito, o kailangan lang kanya-kanya?
Unang-una, local governments will be the ones to implement. And
Yes,
local governments will have that responsibility also of monitoring and enforcing. So ngayon pong optional na po itong pagmamask nito, we request our local governments to continuously do their monitoring and encourage their citizens. Pag nakita na nilang kumpul-kumpul na yung mga tao, kailangan i-abisuhan na nila yung mga tao that they should be wearing mask kung wala po maskara ang mga tao.
There's a suggestion na alongside the easing of masking mandates, we should stock up daw on antivirals dahil available na naman daw. Are we doing this or are we exerting more effort? Kasi medyo hindi pa siya widespread yung dissemination ng mga antivirals.
Yes, ma'am. We've started with this since I think that was February or March that we have released this policy that we are now making these antivirals commercially available. So you can buy that in mga piling drugstores, basta FDA licensed yung drugstore na yan. Aside from that, we have stocks in our hospitals, ito mga antivirals na to. So definitely, ang ating mga citizens can always access. Even some local governments have procured these antivirals, nakakakuha rin po dyan. And tayo naman po, we are, yun nga yung sinasabi that we should be prepared. Kasi baka nga expected talaga. This is something expected. Tataas talaga kaso kasi mataas ang mobility, tapos magtatanggal ng mask yung iba, talagang tataas. What we should be monitoring would be, and what we should prevent would be yung mga severe at critical ay tumaas.
Ma'am, if I may, ma'am, I'd like to ask for if you can give us particulars dun sa. I know we need to wait for the executive order. Pero I suppose at this point everybody's eager to find out kung exactly ano yung parameters, even in general terms. Kasi what we know so far is optional masking in outdoor open areas, well-ventilated areas, and not crowded areas. Are there other parameters that have been considered or are being considered to be put into this new policy?
Well, specific naman po, no, that they will, the Office of the President have agreed with the resolution of the IATF. And within the resolution, i-adapt po nila yan. So tama po kayo, the optional masking will be done in low-risk areas or low-risk settings, actually, and among low-risk individuals. So nakalagay po dyan specific na kapag matanda, kapag may immunocompromise or comorbidities, Tapos po, pina-include din natin yung transport sector. That will be non-negotiable.
Yeah.
So yun po yung mga nakalagay dyan sa executive order kung sakasakaling lalabas.
Okay.
Usec approved na ng China yung world's first inhalable COVID vaccine. Siyempre, mas madali siyang makuha, wala nang masakit dyan. You think this will help kung sakasakali if we can obtain it? Can it help encourage people to get vaccinated?
So, well, we are still trying to review and discuss with experts if this would be more cost-efficient for the government to procure based on the resources that we have, or we just wait for the bivalent. Kasi pag tinignan natin yung ebidensya ngayon, mukhang itong bivalent mas magiging effective sa atin because it addresses specifically the Omicron variant. So patuloy naman natin pinag-aaralan. We are discussing about this. Pero katulad nga ng sinasabi ko, pinag-aaralan din po kasi yung use of government resources kasi hindi naman ganun kadami. So andyan po yung mga options na pinag-aaralan natin ngayon.
So nasa na tayo in the procurement of the bivalent, yung Omicron specific?
We have discussed already with two manufacturers. Meron syempre mga kailangan mga agreements bago mag-umpisa, katulad ng mga non-disclosure agreement. Meron na rin pong mga pag-uusap about supply term sheets at ganun. So we've started negotiations already. So hopefully first quarter of 2023 magkakaroon po tayo.
But it's emergency use as well, emergency use?
Yes, hindi pa ho rin tapos ang trials nito, no? So it's going to go through the emergency use authority process.
Ma'am, yung voluntary masking, of course, it turns masking into individual responsibilities, diba? An individual becomes responsible for his own health and for the health of the people around him. And in cases like that, of course, you would have people looking up to their leaders for examples as to what they should do if they're left to their own choices. If it's okay to ask you po, kayo po, would you, for example, continue wearing masks, whether indoors or outdoors, even if it's voluntary na?
Yes, I will still continue to wear the mask. Unang-una po, may comorbidity rin ako. And pangalawa, ayokong iuwi din kung sakasakali ang sakit sa mga anak ko. So yes, I will still wear the mask.
What about, would you make a recommendation for other officials as well? Or would that be pushing it na?
It is, as you have said, it's per individual's responsibility and assessment based on your risk. Sabi ko nga, kung tayo ay fully vaccinated with boosters, that makes us more confident to do this. But if you have an underlying condition, like you have a comorbidity o di kaya more than 60 years old ka na, you know your risk kapag pumunta ka dyan. Especially pag ang pinupuntahan natin, katulad natin, mga officials tayo, sometimes talaga crowded talaga yung mga pinupuntahan. So definitely, we should still wear our mask pag ano.
And you, of course, meet so many sectors, so many people all in one day. You rub elbows with all sorts of people.
Yes, sir. That's why I need to protect myself and I need to protect my family.
With masking being made optional outdoors, you think malapit na rin na maging optional yan indoors?
Well, pinag-aaralan. That's one of the agreements during the time that we had our IATF last Monday. Na moving forward, we start studying already what would be that possibility whereby we can be able to lift also the indoor masking by making it optional also. But there is one condition, if the booster coverage will increase. So that was part of the agreements and resolution of the IATF. So ang atin pong moving forward actions, the Department of Health was instructed at agreed upon naman na mag-aaral na at titignan kung pwede tayo magkaroon ng parang pilot in selected areas if we can do this, but depending on the coverage of vaccination.
Indoor, you're talking about indoor.
Indoor, yes. But this is towards the end of the year. Yun po yung usapan sa IAT.
That's interesting, Mama. What would be the trigger number in terms of percentage? Or what could be the trigger number in terms of percentage dun sa boostering? That could encourage the DOH, for example, or health officials to say maybe it's time to have voluntary masking indoors.
Yes, actually, sir, ito pong pag-lift ng mask sa indoors and the coverage for vaccination, ito po yung pag-aaralan natin. Kasi pag tinignan natin, we've targeted actually 50% of our targeted eligible population. Sabi natin 23 million in the first 100 days. But really, it's really very slow yung uptake kahit na intensive na yung effort. So ngayon po, ang target natin for October 8, the first 100 days, is just 30% of the eligible. Tapos, pag-phase tayo, 50 and then 70%. So that is what we are going to study also. And of course, look at the experiences of other countries. Na anong level ba yung talagang masasabi mo, we're confident enough na ito yung level ng coverage, and pag nilift mo yung indoor masking, what happens to the number of cases. So that is part of the forward na pag-aaral na gagawin natin.
So under best case scenario pala yung by year end possible yung pilot for indoor.
Yes, ma'am.
Okay. May isa pang pinoproblema ngayon yung mga tao dahil merong report, ang Philippine Airlines mismong nagsabi that one of their passengers who went to Hong Kong tested positive for monkeypox. And they have sent notices to 95 passengers on that flight. Ano po how worried should we be?
Actually, sabi ko nga kanina doon sa mga interviews, unang-una, hindi natin kailangan mag-panic o we be worried. No? Let's get the complete details first. So tayo po ay in close coordination with the Hong Kong Ministry of Health. And just this afternoon, we got word na hindi po siya Filipino national. Nagdaan po siya dito, galing po siya sa iba pang mga bansa, hindi lang po sa Pilipinas. No? He went to nagpunta po siya sa Canada, nagpunta po siya sa New York, pagkatapos dumaan dito and then bumalik sa Hong Kong. So there are a lot of touch points for this specific individual, although we are trying to trace. Dito po sa Philippine Airlines flight, we have already identified, pag inayos na natin, inanalyze, 47 yung close contacts niya. Lahat po ay minomonitor natin. Everybody's asymptomatic at this point.
Gaano katagal yung monitoring nun? Kasi we understand hindi naman airborne yung monkeypox, ano? But from contact with surfaces na merong contact ng infected part, di ba? Yun yung inaalala ng mga tao. Paano yun? How long will the monitoring be?
Yes, ma'am. Actually, ang atin pong incubation period for monkeypox is about 5 to 21 days. So kapag tayo ay nagmo-monitor, we monitor and we do this for the 21 days na meron na sinasabi. Yes, it is not airborne. You get it through close contact with the person who has the disease. So yun po talagang pagkukunan natin dito, pag natabi kayo dun sa tao may mga lesions na, o di kaya ay nahawakan niyo po yung mga hinawakan niya, o di kaya yung mga damit na naisuot niya. So these are the things. Kaya we're closely monitoring, at yung close contacts naman po, hindi naman po talagang nag-rub elbows with the person, but kailangan lang talaga maging maingat tayo at minomonitor natin sila.
Ma'am, going back to COVID-19 dun sa boostering, another aspect of boostering, any news on the possibility of a second booster shot for the general population?
None yet, sir. The evidence still states that the rest of the population's benefit if you receive the second booster is very minimal. So ang ating pong government still trying to look for other evidences that will state that this will be okay for the second or for the general population. So sa ngayon, yun pa rin po ang ating binibigyan ng second booster shots.
Kasi nakaabang kami. Actually, marami nakaabang. especially with the economy opening up and all this talk about voluntary masking. I mean, everybody, of course, is excited, but at the same time, I suppose, like the DOH, also concerned or with a degree of worry. Na finally it's opening up, but oh no, it's opening up.
Oh well, yes. Siyempre mixed emotions tayo. Kaya lang nasanay tayo din po na talagang yung ating para bang napaka-risk averse natin na talagang gusto natin talagang proteksyonan ang buong populasyon as much as possible. But this is reality for us. We need to live with the virus. The virus is here to stay. So kailangan unti-unti natututunan na rin natin at natuturo natin sa ating mga kababayan kung paano tayo to survive with the virus or to live with the virus. So we now have this kind of policies kung saan yung sariling behavior natin will dictate if you get infected or not.
You said recently that pretty soon, hindi na libre yung mga COVID vaccine na yan. Can we say na after this next special period for vaccination, hindi na magiging libre o medyo matagal pa?
I just like to clarify, ma'am. What I said before was, ito po, dadating tayo dun sa point where government would just subsidize those vulnerable in the population. And yun pong mga iba na gusto pa rin makakuha nito because this will become commercially available eventually with the CPR. So sa tingin namin hanggang sa 1 taon naman, mukhang magbibigay pa rin tayo kasi wala pa naman talagang may CPR. And pangalawa, nakikita pa natin yung need to cover the rest of the population.
Ma'am, baka that's a good way of driving up the booster numbers, ha? Sabihin mo sa mga tao na hindi na libre yan next month.
Oo nga, kaya ka tinatanong ko.
Kung hindi pumila yan ngayong buwan, ewan ko lang.
Actually, dun po sa IATF resolution na ipinasa natin noong Lunes, kasama po dun na pinalagay natin that other government agencies will be implementing intervention so that they can boost coverage also of vaccines. For example, ang Department of Tourism, humingi po tayo ng tulong, baka pwede mabigyan ng perks yung mga pupunta sa mga local tourist areas natin na dapat boosted ka pag nagpunta ka dyan. O di kaya baka ang DTI naman makapagbigay din for establishments para lang po magkaroon tayo ng mas mataas na value para dito sa boosters among our population. So hopefully, it's a whole of government approach again and we can be able to improve our coverage.
May isa pang tanong, Usec, yung mga tao. Kasi anong tingin niyo sa simbahan that is not air-conditioned? Would you consider that an enclosed space or pwede siyang outdoor na no masking? Considering na ang dami-daming nagre-recite ng prayers, di ba, kumakanta.
Nagkakantahan yan.
Lalo na ngayong magpapasko, you think masking should be still required in places of worship?
Definitely, ma'am. Definitely. It's part of the enclosed space that we consider. So, kailangan po tayo talagang mag-mask pa rin dyan. Wala pa po tayong mandato para dyan. Ang meron pa lang, outdoors pa lang po talaga in low-risk settings and among low-risk individuals.
So, kahit lumilipad-lipad yung hangin doon, lagusan din, hindi outdoor yan. Kasi yun ang sinasabi ng iba.
Kasi
ang mahirap talaga, parang may mga kanya-kanya ng interpretasyon. Kailangan very tayo doon sa pinapalabas nating guidelines. We be very specific so that people will not interpret it their own way.
Yes, oo nga.
Ma'am, let me leave the last word to you. Anong gusto mong mensaheng ibigay doon sa lahat ng nakaabang doon sa polisiya ng masking? Kasi sa totoo lang, marami nakaabang dahil parang, finally, hindi na kailangan mag-mask outdoors, di ba? So,
nalilito.
Oo, pero nag-aalinlangan o hindi masyadong malino kasi parang, ano bang definition ng open? Anong definition ng crowded? Anong definition ng gano'n? What would you like to tell them? What final words would you like to give?
Yes, gusto ko lang ipaalala, ipaliwanag sa ating mga kababayan na ito pong paglilift o pagiging voluntary nitong pagmamask natin sa labas, outdoor lang po. This would be in low-risk settings. Ibig sabihin, magtatanggal ka ng mask, voluntary yan kapag hindi po matao yung pupuntahan yung lugar o pag di kaya pag nakita nyong maayos ang daloy ng hangin. Ito rin po ay among low-risk individuals lang. Ibig sabihin ng mga nakakatanda, ang ating mga kababayan na may mga ibang sakit, underlying conditions, immunocompromised, hindi pa muna po. Sana we still encourage for you to wear your mask. Yun pong mga nanay na nagdadala ng anak, yung mga anak natin, kung pwede lang po, i-mask nyo pa rin sila pag pumasok sila sa eskwelahan. Pag uuwi na lang, pag maglalaro doon at kakaunti ang tao, tsaka natin pagtanggalin kung gusto nyo yan. And finally, yun pong transport sector natin, non-negotiable po yan. Kahit sa ibang bansa makikita nyo na talagang nakamask pa rin ng mga tao pag sa public transport. Ngayon po, kailangan natin isa-isip po natin at maintindihan natin, this becomes our responsibility. Alam natin na meron po tayo mga layers of protection. Pag tinanggal po natin yung mask, kailangan yung iba matira pa para protektado pa rin tayo. At ang matitira po ay alam natin na pag pupunta tayo sa mataong lugar, isuot natin ang mask. Pagka pangit ang daloy ng hangin, isuot po natin ang mask. Lalong-lalo na po, kung kayo ay hindi bakunado at wala pa rin kayong boosters, isuot nyo po yung mask. So for you to be able to be confident, magkaroon ng kumpiyansa paglabas at maaari mo tanggalin ang mask kapag hindi crowded, magpabakuna po tayo para po tayo ay mas maging protektado, lalong-lalo na ang pamilya nyo.
So sa huli, dalhin niyo pa rin yung inyong mask wherever you go, kahit mag-voluntary na because you may end up having to use it biglaan.
Yes.
Okay. Maraming salamat, Health Secretary Maria Rosario Vergeire. Ma'am, thank you for joining us tonight at ingat po parate.
Thank you, Usec.
Maraming salamat po.
And that's it for the Chiefs. We hope what is discussed here will keep the conversation going. I'm Ed Lingao.
I'm Ami Pamintuan of the Philippine Star.
We are One News, all sides, all the time.